Hello, everyone, and welcome to this webinar presented by Renew Physical Therapy. I'm Kent Timm, the Managing Director of our Saginaw Bay Road location. Today's webinar is dealing with core strength and stability. And this is an important area, and hopefully you'll find this interesting, but also most importantly, helpful in terms of your understanding about what the core is, why it's important, and why people need to be aware of it in terms of their own health and well-being. A little bit about myself. I've been in Saginaw since 1984. I've been in practice as a physical therapist in various capacities since 1982. I have a Doctor of Physical Therapy degree from the University of Indianapolis. I have a PhD in muscle physiology from Columbia University. I'm board certified through the American Board of Physical Therapy Specialties in both orthopedic physical therapy and sports physical therapy. I'm a certified athletic trainer and a fellow of the American College of Sports Medicine. All that's fine and dandy, but as I tell patients, it doesn't mean a whole lot if we can't help you help yourselves with your own problems or prevent problems from happening in the future. So let's jump into this. And before I do forget, there is a question and answer section, and you can provide questions on your screen, and we'll try to answer those as best we can at the end of the presentation. So let's just jump into this and see what we can do here. So first of all, what is the core? We hear about the core, you see some stuff about the core. There are infomercials about the core, but what is the actual core? The core is composed of the muscles of the abdomen. Most people, when they think of the core, they're thinking the stomach muscles, but it's much more than that. The actual core is not just the muscles of the abdomen or the trunk, but also the lower back, as well as the trunk. And so this is a whole group of muscles, not just one or two. And the purpose of the core is that this muscle configuration provides structural support to the spine. It basically is a dynamic stabilizer to keep the pressure off the low back, to keep the structures of the back healthy, and to allow us to move, do sports, lift loads, do what we need to do around the house without having issues. It's when these core muscles get, for lack of a better term, out of whack, meaning maybe a little bit weak, maybe a little bit imbalanced, one being stronger than the other, that problems start to develop. But we'll hopefully talk about that in just a little bit. Now, we're going to talk about some of the examples of the specific muscles of the core. And some of these muscles have got some very unusual names. Way back when, people who came up with these sorts of things decided to call these muscles by their names. They just didn't call them, well, this is the muscle of the back or whatever else. It's not so much important that you know the names of the muscles, but that you understand how they function, where they are, and that you realize it's not just the lower part of the back. There are connections to the hips, to the pelvis, as well as to the rib cage, and even to the neck. So if nothing else, let's kind of jump into this a little bit more. Some of these slides are a little bit busy, but the purpose of this is to show you what we're talking about. On this particular slide, we have the muscles shown for what's called the erector spinae, which is a fancy way of saying the muscles that keep the spine upright and erect. Erector spinae means erect spine. And you can see here that this is a situation, it's not just the lower back. Looking at the skeleton from behind, these muscles start down in the actual pelvic region, on the hip bones. They move up to attach to the shoulder blades, and they also, at least partially, move up to attach to the skull. So the erector spinae, which is part of the core, extends from the base of your skull all the way down to the base of your spine. So this functional core is not just the front of your body. There are connections from the head all the way down to the pelvic region. Other muscles, or another important set of muscle group, are the multifidi, which is a fancy way of saying the small muscles that are on the spinal vertebral bodies themselves. Now, if you do a dissection and actually cut into the body, you would see these muscles are relatively small. So you might not think, they're not that big a deal, whatever else. When you compare a small muscle like the multifidus to some of the larger muscles of the body, it's like, they're just kind of there and whatever else. These muscles are very, very important as kind of fine-tuning things. These muscles help to fine-tune movements, especially when we rotate the spine. The best analogy I can think of, and this is a little bit dated, but back in the days when we had dial radios before digital technology, you would have to dial in and tweak things a little bit to get an absolutely clear signal. You can think of the multifidi as those fine-tuning muscles which keep the spine efficient and help to prevent injury. Whether you're bending forward, backward, turning side to side, it's the multifidi that take care of the fine movements to allow you to do things safely. Now, some other aspects of the core muscles, you might have heard of something called the obliques. There are two sets of obliques. They're the external obliques and the internal obliques. And the reason why these are called the way they are is that the external obliques are closer to the skin. The internal obliques are deeper within the abdomen. And the slide that has the muscles on them kind of looks the same. The important thing to think about here is whether they're internal obliques or external obliques. The external obliques start or actually function from the top down. They start on the lower levels of the ribs and go down into the pelvis on the hip bones. The internal obliques are opposite. They start from the hip bones and go up to the ribs. Now, okay, what's the big deal about this? The big deal about these muscles is their actual configuration. The external obliques are oriented in one direction. The internal obliques are oriented in an opposite direction. So you get this crossover effect. And because of this crossover effect, the fibers of the muscles kind of have a crosshatch. And uniquely enough, when you have this crosshatch configuration, it is stronger structurally than just something that would go up and down or something that would go side to side in terms of the muscle fibers. This crosshatch effect is similar to the construction of a radial tire. So a radial tire in your car is more efficient than a non-radial tire. So as these obliques function appropriately, they allow the spine to be more efficient. They allow the human body through movement to be more efficient. Also, from a protective standpoint, the best analogy that's been come up with is if you have a radial tire or even a regular tire, traditionally with the uniquely parallel fiber treads, but with a radial tire, if these oblique muscles are not fully developed, just like if a radial tire is not fully inflated, what happens? The tire sags with the back. You have more and more compressive force. So it's like running your car on the I-75. If your tires are not fully inflated, guess what's going to happen eventually? You're going to have either a puncture or a flat tire or some sort of breakdown. The point that we're trying to make here is the obliques are very important because if they are not sufficiently strong and balanced, it's like running your car on I-75 without your tires fully inflated. You are more prone to lower back problems, especially problems with your intervertebral disc, leading to sciatica, leading to potentially surgery. So this is one of the reasons why we're talking about this. If you keep the oblique strong and healthy, you are helping yourself prevent possible back problems. But there's some other muscles involved with this as well, okay? On the back side of the back, pardon the alliteration here, you have a muscle called the quadratus lumborum. Why is it called the quadratus lumborum? Quad means that basically there are four sides to it, and the lumborum refers to the lumbar spine. When you put your hands on the small of your back, the muscle you feel there off the bony parts of the spine is the quadratus lumborum. And so this is a primary stabilizer of the lower back, and it works in combination with the multifidi and with the oblique muscles to help fine tune and position the lower back in space. So this is a very important muscle in terms of not only being able to lift and move and do our routine activities of daily living or athletic activities, but also helps protect the lumbar spine, the discs, the nerves, and prevent injury. Now, when you think of the core, most people naturally think of the rectus abdominis. The rectus abdominis is the muscle that is, on the front in terms of the, quote, stomach muscle. This is the muscle that people who are bodybuilders or who are into cosmetic sorts of things, this is the muscle they try to develop for a, quote, six-pack. There's nothing wrong with the six-pack, but the core is more than just the rectus abdominis. You can have a very nicely developed rectus abdominis. You can have a superb-looking six-pack, but still have a very weak functional core and end up with lower back problems. So it's all of these muscles working together, not just one or two of them. The other muscle on the front that sometimes gets overlooked because people kind of focus on this six-pack effect is something called the transversus abdominis. To just back up here a second, you can see by the slide, hopefully, pardon me just a second here, the rectus abdominis, the fibers run up and down. So this is the muscle that is primarily developed when you do sit-ups or crunches, depending upon how they're done. As we'll talk about a little bit later, depending upon how you do sit-ups or crunches, you may actually be doing more with your hip flexor muscles down here than you are with your abdominal muscles. But the point I'm trying to make at this point is that the rectus abdominis, the fibers run up and down. And now if we go to the next slide, with the transversus abdominis, the fibers go side to side. You can see here that the transverse abdominis covers most of the front of the abdomen. If you would cut through the abdomen, this is where you'd have the intestines and the other internal organs. So you have, in combination, you have the transverse abdominis, whose fibers are like this. You have the rectus abdominis, whose fibers are like this, the transverse abdominis, whose fibers are like this. Then on top of that, you have the internal and external oblique. So you have a very highly developed structural system where you have muscle fibers running up and down, side to side, and then in both crosshatch directions. What this creates is a very, very strong but very flexible stability system that not only supports the internal organs and supports the lower back, but enables the entire body to function, that we'll talk about in a little bit. Now, finally, over here on this slide, you can see this is a cutaway view that's meant to show what's called the muscular corset effect. This is like an old-fashioned ladies' corset back in Victorian days, or something you'd see on Downton Abbey or something like that. But the idea is, instead of like a surgical belt or a brace, this is a dynamic brace. You can see from this crosshatch diagram that in the core itself, you have got muscles encircling the entire lower part of the body. This right here is the intervertebral disc. This is basically a spinal segment. These are the muscles of the back part of the back, but they are connected throughout this entire structure of a core. And it's a circumstance that just because these muscles back here tend to be a little physically bigger, that doesn't necessarily mean that they are physiologically stronger. And you could have very nicely developed muscles up here, but if you don't have nicely developed muscles around the other parts of the core to function, then you're not going to have an efficient system. When you don't have an overall efficient system, that's when things break down, you get abnormal wear and tear, and you start to get problems. Okay, so let's move on to the next area here. to hopefully answer some of these things. I've alluded to some of these situations. Why is the core important? I've already kind of mentioned the aspect of preventing low back pain. That's what LBP stands for. But also the core is very important for posture, as well as something known as dynamic stability. So why is the core important? Posture, dynamic stabilization ability or dynamic stability, and prevention of low back pain. Okay, now posture. Some of us are old enough to remember when back in the day, so to speak, that you'd be sitting at the kitchen table and your mother or your aunt or someone, your grandmother would say, sit up straight. Well, their intent was good. Now, there's nothing wrong with that, and I'm not trying to get anybody upset with me. But uniquely enough, if they were more, and not to imply that they would be, but if they were more in tune with things, it would be not so much sit up straight, but engage your core, because that will make you sit up straight. The functional core is the engine that drives correct body alignment. Whether you're seated, whether you're standing, whether you're driving, whether you're in a position to do your work, whether you are doing an athletic activity, whether you are playing golf, if your core is efficient, if your core is strong, if your core is functioning appropriately, your body is going to be in a correct alignment. You're not going to have some of these postural problems alluded to in this slide here. If you have a weak core, you are more prone to having a forward head posture. You're more prone to having a rounded shoulder posture. You're more prone to having problems in the middle back, in your hamstring area, in your knees, the whole system. So it's like, what? You know, this is kind of interesting, but if the core is working strong enough, if the core is balanced and appropriately functional, you're going to promote appropriate posture. You're going to get balance to allow efficient movement of the head, the arms, the torso, the legs, and you're going to get decreased stress and strain on the major joint systems. What does that mean? More efficient movement, less chance of injury, less chance of abnormal force, less chance of arthritis, less chance of back problems, less chance of basically kind of being hunched over, so to speak. So the core is the driving force, the dynamic driving force for appropriate posture in the human body. Now, another thing I mentioned is dynamic stability. What this basically means is a person's ability to control their center of gravity. If you're, say, walking, like you see in this slide here, a person's kind of walking on a log, kind of doing a balancing act. If they can control their center of gravity, they're not going to fall off the log. And through appropriate core strengthening, if you can create or establish dynamic stability, you're going to have a lesser chance of falling. You're going to basically be able to do things more efficiently with less wear and tear. You'll be able to do more work with less fatigue, and you're going to avoid problems. In physical therapy, this is known as proximal stability to promote distal mobility. What that essentially means is a stable core allows efficient, comfortable, less stressful movement of the arms and legs, so you can do what you want to do out there in the real world with minor chances of problems. Okay, now we mentioned prevention of lower back pain. We mentioned the circumstance of promoting posture. What has also been shown definitively is that an efficient core, a strong core, will prevent low back pain. If you have increased core strength, you will prevent problems, especially with the intervertebral disc. The part of the slide on the right here shows a normal disc versus a herniated disc. This is what's known as a slip disc or a ruptured disc or what have you. And here you see the part of the disc coming out and compressing the nerve root. This is where you get pain like sciatica or loss of sensation or foot drop, bottom line problems that affect our ability to walk, function, do what we want to do. The research is clear. The stronger the core, the more efficient the core, and by efficiency, I mean not just strong, but strength of the muscles in a balanced fashion will decrease pressure on the disc, which decreases the chance of disc disease, which decreases the chances of arthritis, which decreases the chances of sciatica. Basically, less pain, more function, healthier individual. So that's why the core is very, very important. But it's not just strength, it's balanced strength. If you get the abdominal muscles, say the rectus abdominis, too strong relative to the quadratus lumborum, you're going to have an imbalance. If you get the oblique muscles on one side stronger than the oblique muscles on the other side, you're going to have an imbalance. So it's not just strength overall, it's getting things stronger and then making sure they're an appropriate level of balance to promote function. Okay, so that's all well and good. And this is kind of the preface or the base information in terms of what we do next. So the practical aspect becomes, how in the world do we strengthen the core? And the answer is exercise. There are many things out there that you can see. Take this supplement and you'll get a stronger core. Attach yourself to this device, you'll get a stronger core. No disrespect intended, there's no research to demonstrate the effectiveness of those sorts of things. The only way to strengthen the core is through exercise. So if you're not into exercise, you're going to need to get into exercise, no disrespect intended, if you wish to have a strong, healthy core. If you're already into exercises, it's maybe a catch-22 situation. It's a good thing because there are many different things that you can choose from. But the frustrating thing is which ones are better or which ones work the best. There are many choices. The good news is most all of them work. The key though, several of the keys are daily performance. Many folks try to work on their core, maybe once a week or every other day. If you're going to strengthen your core in terms of real functional ability to promote overall efficiency of movement and to prevent back problems and other sorts of problems, you're going to need to work on your core daily. There is a relative progression of things because, as with any sort of exercise, if you go into something very complicated early on, you might create problems in terms of muscle injury or tendon injury rather than solve problems. And it also gets very, very frustrating because, as with any sort of exercise program, when you start something new and different, there is a period where the body has to adapt. You get that feeling of muscles you haven't used in a while, and sometimes that feeling can be very, very intense. Okay. In terms of a potential progression, these sorts of things follow, okay, the circumstances of easier to harder. So if you've never done core work before, you'd probably want to start in a seated position, and we'll show an example of that in just a moment. Then there are other circumstances where you're doing some things on your back. If you can, then you move to things on your stomach, and then to things on hands and knees or elbows. And this is meant to show some things that work in terms of efficiency. There are many variations on the theme. You could do a Google search on core exercise and you comes up with hundreds of them. The ones I'm trying to present here, if nothing else, are an example. You may have examples that work better for you, but I'm giving you these examples because they have the most data behind them. There's the most science behind them in terms of the effectiveness. Okay, so let's start out a little bit and just show a circumstance of a seated position. Now the slide here is maybe not the best, but if you've never done core work before, or say you have a desk job and want to start some core work, or even if you have a decent core or you feel you have decent core strength and you want to add something throughout the day to help take it to another level, an example here is a seated elbow desk push down. Now, a lot of these exercises don't have a definitive name. You can call this thing whatever you want. The idea here is what the person is doing is they're seated, you're putting your elbows on the table, and you're kind of pressing down with your elbows into the table. If you're seated now, example at home or wherever you're watching, if for some reason you're watching in a motor vehicle, please don't try this while you're in motion. But if you just put your hands, or you just can kind of rest your chin in your hands like this, but put your elbows on the table and then just kind of gently press down into the table. What you'll feel is an activation of your rectus abdominis and your transversus abdominis. That's a core exercise. And that's an interesting sort of thing because it's basically, you're just kind of pushing down gently. Now, if you notice, while I'm doing this, because I'm doing the exercise right now, even though it may not show on the camera, if you notice, I'm not holding my breath. A lot of these things are counterproductive if you hold your breath because it'll drive your blood pressure too high. All these different exercises are meant to be done in a controlled fashion so you're not working too hard. The general rule of thumb is if you can't carry on a conversation or if you find yourself holding your breath, you're working too hard, you're pushing too hard, the exercise is potentially creating other problems in terms of blood pressure problems versus trying to get your core developed. So the question is, how long do I hold this if I'm doing this particular push down example? How long do I hold it? How many reps do I do? The answer is keep it comfortable and as many as you can. I've been a therapist since 1982. Back in the day, the general science in medicine and physical therapy said do 3 sets of 10. Research has shown that more than 3 sets of 10 is better than 3 sets of 10. The key is to keep it comfortable. If I can hold this position for 10 seconds, that's good. If I start feeling uncomfortable, that's not good. So if I hold it for 10 seconds, but on second 11 it starts getting uncomfortable, I'm holding it for 10 seconds. So you hold it for 10 seconds, you want to rest it for the same amount of time that you held it because it gives the muscles a chance to recover. Most people, when they're doing exercises, don't leave enough rest in between repetitions. And so it's like trying to work a machine without enough oil to keep the gears working smoothly. So if you're holding it for 10 seconds, rest it for 10 seconds. If you have time to do a whole bunch of repetitions, do a whole bunch of repetitions. If you're, say, at work and, okay, I have a second in between phone calls or I've done this project and now I'm going to go on to another project, okay, I'm going to hold it for 10 seconds, rest it for 10 seconds, go on to the project, and then do it again maybe a little bit later on. We have some patients who have, going back to desk jobs, they'll do a couple of reps every hour. So, okay, it's the top of the hour, 10-second hold, 10-second rest, 10-second hold, and then on, and they'll repeat that process throughout the day. The idea is keeping it comfortable. If you're feeling pain, if you find yourself holding your breath, if you can't carry on a conversation that's too much, too hard, you're going to run the risk of injury. And those same principles hold for the other exercises we'll show here in just a moment. So the idea is 10-second hold or so, 10-second relax, as many repetitions as you feel comfortable doing. Okay, on your back, people may be familiar with this. It's called a bridge. Some people call it a hip up. Again, a lot of these exercises do not have definitive, universally agreed upon names. So you can call this whatever you want. It's just a matter of how you do this, quite frankly. In this position here, you can see the young lady in a starting position on the top part of the slide. They're resting on their back. What they're going to do is try to tighten up the muscles in their stomach, comfortably tight, and then lift their hips up in the air. So this is not a circumstance where you're going to try to put your belly button on the ceiling, which is kind of a cliche that used to be used. The idea is you tighten up the muscles in your core, and then you lift up only as far as you feel comfortable lifting. You might want to hold it for a count of 10. If you can't hold it for 10, hold it as long as you can comfortably, again, without holding your breath and being able to carry on a conversation. And then rest it for as long as you held it. If you held it for 10, rest it for 10 before you try another repetition. If you didn't hold it for 10, rest it for that same period of time. You'll find as you do these, you could be completely out of shape. You could have back pain or whatever else. But if you're doing these exercises correctly, even if you have a current injury, you will find that you'll be able to hold them longer and do more repetitions without increasing your symptoms as you do this day to day. That's the importance of daily performance. If you're experiencing something other than that, then it's time to get re-examined in terms of the possible problems that you're experiencing. So this would be the bridge sort of thing. And if you're at the point where, oh my goodness, I'm lying on my back and I can tighten up my stomach muscles, but I just cannot lift my hips up in the air, that's okay. As you try this, more and more repetitions, this will develop with time. So as you work on it, things will get better. Now, as I mentioned before, there are many other different things that you can do lying on your back. This particular exercise is the kind of the simplest. It's got the most data behind it. But if you have something else that you want to try, by all means, give it a try, go for it, but keep those principles in terms of comfortable activity in mind. Now, if you can lie on your stomach, this exercise, some people call it the Superman, and for lack of a better term. Basically, what you're doing is you're lying on your stomach, you're tightening up the muscles in your stomach and your rear end and the lower part of your back. And if you can get to the point of being able to lift up your arms and legs like this, that's tremendous. Most everyone, as they start this, may not be able to do that. So it may be in a situation like this, you're just in this position and you're tightening everything up. And that's okay. That is a core exercise in and of itself. But when you get to the point where you can tighten up and things are like, this is kind of boring, or I've been doing this, or I can hold it for a minute or something like that, this would be a way to challenge yourself by lifting up maybe one arm at a time, or both arms, or one arm on the opposite leg. There are variations on this. So these are some things that will be done or can be done in a prone lying or lying on your stomach sort of position. Okay. Now, this is a start of, or at least a sequence of some things that can be done on your elbows. And this is what's known as a plank. Or in this position here, some people would say, hey, this is a push-up position. Or if you're from the military, this is known as a forward-leaning rest. Yes, all of the above. Or some people see this sort of thing. This is maybe the more traditional sort of forward plank position. But whether it's this, or if you're on your knees and just kind of bending from your knees instead of from your feet, that's fine as well. The idea is you're going to get in this position and try to hold it as long as you can comfortably. Early on, if you've never done this before, you may be talking 2 seconds, and that's okay. Because as you do this over time, 2 seconds becomes 3 seconds, becomes 10 seconds, becomes a longer period of time. If you have when you have a steady core, or once you have a strong and balanced core, one of the functional tests out there is, in terms of a question, can a person hold this position for at least 60 seconds without collapsing, without holding their breath, without getting so uncomfortable if they start to shake and things. But if you're just starting these sorts of core strengthening procedures and give this a try, you may think, oh my gosh, I can never get to 60 seconds. Well, if I can do this, you can do this. And I can do this now at age 62 because I started working on these things back when I was about age 32. It takes some time, but it's well invested time, because over time and practice, the chances of you having back problems diminishes greatly. Now, if it were just a matter of working the stomach, or just a matter of working the lower back or the backside, that's all fine and good. But remember, we mentioned the importance of the oblique muscles. And to get some stuff done for the oblique muscles, this is where we can look at a side plank. This is a person balancing themselves on their elbows on the side. This is a tough exercise. It's much more difficult than the previous one. I'll back up just a second here. This may look, oh my goodness, this is hard in and of itself. But once you've tried this, you'll realize that this is more difficult in and of itself because it's forcing the oblique muscles to work differently than they typically do. And as they work different when they typically do, this promotes the strengthening, it promotes the greater efficiency, it helps to promote an overall balanced core. The same principles apply. Comfortable length of time, no holding your breath, being able to carry on a conversation, resting for an appropriate period of time, and repeating this on a daily basis. Now, for folks who have been doing these sorts of things and maybe need a little bit more of a challenge, then we get into something that people call the bird dog or other sorts of scenarios. This is on hands and knees, and you're stabilizing your core, and slowly, this is not like a calisthenic where you're seeing how fast you can move. This is a slow extension of one arm and the opposite leg. Holding this for a period of time, maybe 10 seconds, maybe longer. Then going back to the starting position and then alternating back and forth. This involves the entire core, from the hips up to the shoulders and the neck, as well as the muscles on the back, the recti, the transverse muscles on the front, and the core on both sides. If you are skeptical about this, give this a try. And if you say, hey, this is, not working so badly, chances are you're moving too quickly. If you would try this in a slow, exaggerated fashion, it will become very clear that, oh my goodness, I either have some core work to do, or, oh my goodness, my core's in pretty good shape. So this would be more of an advanced sort of situation to try at home. Now, once our friend, and I'm using that term very facetiously, Corona is over and done with, and gyms open back up, then the possibility exists of doing a lot of core things on gym-based equipment. We're not going to talk about those in today's webinar, but hopefully we'll be able to talk about those in the future once people get back to the point of being able to go back to gyms or the YMCA and the threat of the COVID-19 virus has passed. Okay. In summary, and let's see here, we need to adjust this just a tad. In summary, a strong core is going to promote good health, reduce the risk of injury, and especially help prevent low back pain. The core is going to help promote posture. The core is going to help promote overall health and efficiency of movement. Overall health and efficiency of movement means you're going to be able to do more things or do the same things that you normally do with less fatigue, less chance of injury, and greater health. And all it takes is a couple of exercises or even one exercise, just a few minutes a day. One repetition is better than none, but also the idea of building yourself up, doing this each day, challenging yourself, but also being patient because core work takes time. I mentioned myself, I can do a plank now for a good long period of time, but it took me years to develop that. The important thing is not so much how long you can hold it, but the fact that you're able to hold it and do exercises to help strengthen your functional core and help yourself stay healthy. Okay, again, I'm Kent Timm. I'm talking to you today from our Bay Road location, but any of our various Renew Physical Therapy locations, and let me just kind of adjust this over here a little bit so we include our friends in Caro as well as our friends in Eau Grais. We have many sites throughout the Saginaw Bay region, and even though I'm your presenter today, any of our therapists would be able to help you if you have questions or need suggestions on developing programs and services to help yourself with this. Okay, so at this point in time, let's try to open this up in case there are any questions. And my colleague, Kate, will hopefully come back on and help me out here. I do know that there are some questions out there, and I'll turn it over to Kate and see what we can do to help answer any questions you may have.
Sounds good. Thanks, Kent. We had one person ask, and I know you went over some of the exercises, but what is truly the best exercise for a strong core? Is it sit-ups? Is it planks?
The answer is yes, all of the above. It really takes a circumstance of a balanced set of exercises based upon what the person is in their own current development. It's a difficult question to answer singularly. Pardon me, just a sec. Overall, if you would compare a crunch or a sit-up or a curl to a plank would be preferable because it's working the core and primarily the core itself. Sit-ups, if not done correctly, you may end up getting more of a lower back or a hip flexor stimulus or strengthening effect as opposed to a core strengthening effect. So it really takes a matter of finding out where you are relative to what you need. What I would suggest for the person who asked the question is try out some of the different things that we presented here today. Find the one or ones that are in that sweet spot of being just challenging enough to try versus either too difficult or too easy. Then, after trying those sorts of things, if you have questions, you can always contact one of the clinics or ask for a free screening. We offer 15-minute screenings where you could get with one of us person to person wearing, I misplaced it, but yes, you could come in wearing a mask. Obviously, I'm in my office alone, so I'm socially distanced, so I'm not wearing my mask. But out in the clinic, I'd put my mask on. So we could work with you and help you answer that question specifically for your own individual needs. So to try to, without getting too wordy here, if you're going to choose between a plank and a curl up or a crunch, go with the plank.
Great, that's some good info. And to follow up on the exercises too, anyone who has registered for this webinar with their email will also get another email that has a printable exercise summary of everything Kent talked about today. So that'll be coming. The next two questions kind of go together, maybe falling in the postpartum category, but asking what the best ongoing exercise is for someone with diastasis recti or who has had a C-section.
Great questions and very applicable questions. And with that, I'm going to defer. Not that I can't answer the questions, but I don't want to run the risk of speculating because I could suggest one thing or another, but without knowing the specific case or the specific needs of the individual patient, I could be making an improper suggestion. What the person really needs to do would seek the services of someone who specialized in pelvic floor and women's health physical therapy. Renew does have a specialist in the personage of Kayla Saar, who's based at our Saginaw State Street location. I'm from Bay Road, so I always stay Bay Road. But it's important to have a specialist physician or a physical therapist specialized in women's health and pelvic floor procedures to do an analysis or an evaluation first to look at your individual needs. Once those individual needs are known, then she or someone who's skilled in those specific areas can make the appropriate recommendations of exercise.
Great, thanks, Kent. We did just have a new question come in, not specifically about core, but asking what exercises can help with hip flexor strengthening.
Okay, hip flexor strengthening, good question and thanks. What you can do, and this is a circumstance, I'm going to try to back up here just a second and give an example from one of the previous slides. Okay, I'm going to back up here to the bridging slide, which hopefully you can see. And it's a matter here, I'm going to kind of talk through it a little bit and hopefully the cursor will show up. In this position here, if you tighten up your stomach muscles, if you tighten up your gluteal, your rear end muscles at the same time, you're doing a very nice preliminary core activity. What you then can do for your hip flexors, if you can imagine, then moving your knee up, whoops, I'm moving the slide. I gotta be careful here so I don't undo stuff. But if you can imagine moving your knee up toward your chest, not pulling it up, but moving it up. In other words, you're not pulling it up or doing something with your hands. you're moving it up yourself. If you can move it up, move your knee toward your chest while keeping your tummy and your rear end tight. You move your knee up, hold it for like a count of 10, relax it down for a count of 10, and then alternate. So it's like right knee up, left knee up, right knee up being held for 10, relax, left knee up being held for 10. That will very nicely work the hip flexors. So that's a more practical sort of circumstance. Now to back up one more, this is the first one we talked about with this seated elbow desk push down. So I'm going to get in the position here, and unfortunately you can't see my legs, but if you can imagine here, I'm doing this exercise, I feel my stomach working. Then if you try to pick one foot up off the ground, you're going to feel your hip flexor working fairly nicely. So it's a matter of, okay, I'm doing this, I'm doing the core, but now I'm also adding a hip flexor exercise by lifting one foot up. I'll rest it down and then do the other one. And so this is not isolating the hip, but the body doesn't work in isolation. This is working the core and the hip flexor at the same time. For the person who's asking that question, if you'd like some suggestions, feel free to give us a call or send me an email. We can arrange for a free screening, or I can try to answer your question over the phone or with a return email.
Awesome. Another person asked, just in regards to core strengthening in general, how Pilates would fit in with all that?
Great question. Pilates is a very good overall training technique. The unique thing about Pilates is it's predicated almost, the whole philosophy is predicated on a strong functional core. So if you're doing Pilates, Pilates will very nicely develop your core and then help promote that dynamic stability that I mentioned a little bit earlier. Let me back up here a second to the slide, and hopefully this can be seen. But this is where what Pilates does, it really follows this principle of promoting proximal stability or core stability to then allow distal mobility. Because Pilates engages the core and then does motions and exercises with the arms and legs while the core is stable. So Pilates would be the next step up. It not only works on the core, but it works on the arms and legs as well as the core. So yes, it's a very good combination.
Great, and then we just have one more question and then you can go ahead and wrap up. Somebody said they've been working at a desk job for many years and they're wondering how to kind of ease into the core strengthening.
Okay, for the desk job person, this would be your good starting point. Since you're used to working in this position here, this can get you started. And then it's a matter of trying maybe some of the other sorts of exercises or that combination of elbow push and knee raise to promote that hip flexor can get you started. And then hopefully you'll be able to progress into some of those other exercises, the bridge, the Superman, the plank, the side plank, and eventually to something such as that.
Oh, we did just have one more pop up, a new question. They asked, what about using a balance ball? Does it help or should it be after some strengthening with the exercises you've shown?
Another great question. Right now, I'm presenting this sort of situation. I'm sitting on a Swiss ball. So I'm sitting on an exercise ball. And basically what this allows me to do is keep some degree of core activation while I'm seated. If exercise balls are used, sometimes folks get a little bit frustrated because they can be very frustrating until you get used to them. There is nothing at all wrong with using them. In fact, as people develop and progress in core training, I don't have a picture of this because not knowing what the audience is, you don't want to get things too complex and cause problems. But a lot of folks, if they find planks are not hard enough for them, imagine this person down here doing a plank, instead of their elbows on this mat, their elbows are on a Swiss exercise ball. That creates a little bit more challenge to keep things stable. So yes, Swiss exercise balls are a very good advancement or a very good feature once you become comfortable with some of the basic exercises. So very good thing.
All right, I think that's it for the questions.
Okay. And again, to summarize, the core is important not only for injury prevention, but also to enable healthy activity. The frustrating thing is there are many exercises out there that you can do. The good news is there are many exercises you can do. It's just a matter of finding something that you can do or want to do on a daily basis and being patient, because it takes a while to develop the core. If you could develop the core overnight, great. I mean, we wouldn't need this webinar or what have you, but that's not the reality out there. So find something that you can do, work at it, progress, and things will be very, very helpful for you. And as things go along, physical therapy is an important part of this. There are many choices out there, but we at Renew want to make a difference in people's lives. That's why we present these seminars as well as webinars rather, why we make ourselves available in addition to the routine clinical services. So if you have questions about this, feel free to give me a call or send me an email. We can make arrangements to get your questions answered. And again, there are multiple locations throughout the Great Lakes Bay region. I've got a lot of colleagues. We've got a lot of qualified folks who are willing and able to help. So I hope you've enjoyed this webinar. I hope it's been helpful. If you have questions and comments, please feel free to follow up, especially if you have other topics you'd like to see in future webinars. And with that, I'll turn it back over to Kate. Thank you very much for your attention and attendance. And it's been a pleasure, and hopefully this has been helpful for you.
Thanks so much, Kent. Great presentation. Thank you.